Hi everyone, welcome back to my channel. I'm Dr. Amrika Seshadri, plastic surgeon. I want to talk to you today about collagen. So collagen is this really versatile substance and it's one of the major proteins in our body. But how do plastic surgeons use collagen? There are a lot of ways in which this is used. Let's start with the most common use of it, which is for things like scrape injuries. So when someone gets injured, so there's an area which is exposed, and typically what happens is there's a lot of yellowish fluid coming out of this, and this is very rich in nutrients, which means that it's a great, shall we say, food for bacteria. So when we take away all the skin remnants and then place a layer of collagen on top, it almost acts like an artificial skin layer. And that accelerates healing, it 10x's healing, and the resulting scar is very subtle. And also there is no tendency for it to become thick or become into a hypertrophic scar. The second most common way that I use collagen in my practice is on burns, especially burns which are caused due to hot water or hot oil. So when this occurs, the layer on top of the skin, especially with water which is boiling water, it's at 100 degrees. If it's in a pressure cooker, it's at 170 degrees, basic physics. But when that happens, if it's 100 degrees, then the layer, the top two layers of the skin blister up. And so if you can drain that fluid and then cover with collagen on top, the results that you get are much, much superior to the kind of results you get with just continuous dressings. The problem with dressings is that yes, it does heal eventually, but the problem there is one, repeated dressings, two, extreme pain during those dressings, and no matter how much pain relief is offered, it doesn't really alleviate that kind of burning pain. And three, the tendency for hypertrophic scarring, which is much, much less with collagen application. And number three is when, let's say, I require a skin graft to be placed in a wound, or rather a patient has some kind of injury and then they require a skin graft, which is the top 3 layers of skin that is taken from, say, the thigh or the back and placed elsewhere. So the part which donates it, which is called the donor site, is covered with a layer of collagen. So this has a dual role. One, it reduces bleeding from that donor site significantly. And two, the healing process with the collagen application again prevents hypertrophic scarring, which is very common in Indian skin types. So when skin is harvested from a donor site, the part which donates the skin to the other part, this part can get well, shall we say, this part can become very displeasing to look at later on. But with collagen therapy, the healing is a lot smoother and we can take care of pigmentation issues much, much easier. So these are my top 3 ways of using collagen in therapy. I hope you enjoyed the video. Please don't forget to share, like, and subscribe.